Hello, my name is Adam Riedel. This is my skills video for BSN 225 for ophthalmic medication administration. The first thing I'm going to do is verify in the MAR, the provider's order. In this case, we have a order for Timolol 0.25 solution, 1 GTT per each eye, BID. So for me, that means that the Timolol eye drop medication for twice a day, 1 drop per eye. 1 drop is going to be 0.05 milliliters. So what we're going to be doing for them is it's going to be 3.4 milligrams per milliliter. So 1 GTT is going to be about 0.17 mgs over mLs, a super small amount of medication really for this. But I'm going to verify the 6 rights of medication administration before I get this off the med cart. So this is an order for Amy Riedel. It's a 1 drop each eye twice a day dose, and it's going to be ophthalmic route at 540, and I'm going to make sure I verify and document this into the EHR. So once I have the eyedroppers, I'm going to go into my patient's room. I'm going to knock on the door, enter, close the door for their privacy, and then I'm going to verify who I'm talking to by asking the patient their name and date of birth.
Amy Riedel, 21093.
I'm also going to make sure that I ask the patient if they have any allergies to medications or external things as well. Do you have any medication allergies, or are you allergic to anything that you know of?
No.
Okay. So I'm going to explain to the patient why I'm in the room and what I'm doing. So ma'am, what we're going to be doing is I'm going to be administering some eye drops for you. It's called Timolol. Your provider ordered to get 1 drop in each eye twice a day. So I'll be back again 12 hours from now. But what this does is this is to help prevent pressure in your eye. And a lot of the times this is helpful to prevent and treat glaucoma. This is a beta blocker, so it will have a little bit of a systemic effect. So after I do administer, I am going to put a little pressure on your nasolacrimal duct on the bridge of your nose there. And then I'm also going to make sure I ask any adverse effects, or explain any adverse effects, and ask if she has any questions. So the adverse effects of this drug, they may include blurred vision, eye irritation, double vision. You might experience headaches, dizziness, or nausea. And it's really important for you to tell the provider or contact your healthcare provider if you experience any of those effects. You're also going to experience a little bit of stinging or burning sensation after the drops are placed as well. Ms. Riedel, do you have any questions for me?
No.
Okay, so what we're going to do is we're going to now administer the eye drops. I'm going to use hand hygiene by applying hand sanitizer here and getting my gloves donned. I also have a cotton ball to use on her lower eyelid, or the bony orbit below her lower eyelid, rather. I'm going to bring the camera down a little bit so you can actually see me doing this. So ma'am, are you able to take your eyeglasses off for me, please? Thank you so much. And also, if a patient does express that they would like to administer this by themselves, that can be fine. It just needs to be documented in their chart as long as the nurse is supervising them as well. But in this video, I'm going to be administering them. So I have my cotton tip applicator, my gloves, as well as my eye medication. For this demo, I'm not going to actually be administering anything. I'm going to leave the cap on, but we are going to put this 1 to 2 centimeters above the conjunctival sac, and I'm going to place the cotton ball on the lower orbit, pulling down with my thumb, asking the patient to look up for me, and going up with the upper eyelid, and then 1 to 2 centimeters above the conjunctival sac, I'm going to drop one eyelid right there. And if she blinks or it falls down, I need to make sure that I re-administer, which in this case it did not. However, I am going to apply a little bit of pressure to her nasolacrimal duct, just a little bit, to make sure, since this is a beta blocker that has systemic effects, never apply the pressure directly to the eyeball. Does that feel okay, ma'am?
Yeah.
Okay. About 30 seconds there. We're going to apply that to her second eye as well. So pulling down on that bony orbit, exposing the conjunctival sac. May you look up, ma'am? Thank you. And 1 to 2 centimeters, we go. and just a little bit of pressure. I'm using the cotton tip applicator instead of my finger itself just to make that a little bit more comfortable for this patient. Does that feel okay, ma'am? Okay. Is there anything else that you need right now, ma'am?
No.
Okay. And I'm going to take off my gloves and properly dispose of them into a receptacle and use hand hygiene. Make sure that the bed rails are up, call lights are in reach, and that is that.